We all know that syringes are very accurate when we need to dispense medicine to children. It's very handy and comfortable to use a syringe. However, it has some limitations, and the dilemma is if you have a larger syringe with a greater capacity, the neck of the bottle is too small, and then you can't fit the syringe into the bottle to extract the amount of medicine that you need. So you end up also at the end of the amount of medicine in the bottle, you end up pouring the medicine into the cap and sucking it up in that fashion, which is quite a messy affair and not very user-friendly. I've come up with a solution, and it's called the measurement cap. And used in conjunction with a syringe, it's a very user-friendly way to administer medicines to children. So what you'll do is you'll get the bottle and just take off the cap that the bottle came with from the factory and just replace the cap with the measurement cap. Now we have the added option when using a syringe to insert the syringe into the cap and turn the bottle upside down, and in that way extract the amount of medicine that we need to administer to the child in an accurate way without making a mess. We all know there are times when you can't put your child down because they are crying hysterically and they've got a fever. Now both my boys are too large to hold like a baby anymore, so I'm having to use the teddy bear. But while you're holding the child that's crying, you can administer the medicine in this accurate way using the syringe in conjunction with the measurement cap, and in that way not having to put the child down and using one hand and administering the medicine in that fashion. Syringes are also very accurate when one needs to administer medicines in quantities at the same time. So for instance, we'll need 5 milliliters of the one, and we'll carefully, without making a mess, extract 5 milliliters from the one and then also 2 milliliters from the other. As an example, once again in conjunction with the syringe, measurement works very accurately without making a mess. Once again, it's very important to use a syringe, especially when one is administering antibiotics, because one knows that the measurement needs to be very accurate and that the course needs to be completed for the antibiotics to work properly. But another way that you can use it is if you have users that are illiterate and that do not understand the instructions on a bottle. You can color code the bottle in conjunction with the syringe, and using the measurement cap with that, make it possible for the user that doesn't understand or can't read the instructions to go on a color coding. And in this instance, let's just say a 6-year-old needs up to the red mark, so you can have that amount up to the red mark. Medicine is nearly empty, but you can see with the measurement cap you can use up till the very last drop. Or for instance, if it's a 9-year-old, we can go to another marking. In this case it's a black marking, and know that the medicine has been administered in the correct amount. Another way that the measurement cap can be used in conjunction with the syringe is when mixing pesticides. We all know that it can be very messy to use the methods with pesticides. Sometimes this creates a mess, you get pesticides on your hands. By replacing the cap with the measurement cap and using a syringe, it's a lot more accurate, a lot cleaner, and there's no mess. And once again, when working with a target market that might be illiterate, it's easy to color code and in that way explain the amount of pesticide to be mixed with water. Well, there you go. I think there are so many uses for the measurement cap. It can be used with a variety of liquids in a variety of fashions. Really, the sky's the limit as far as options are concerned in that. The cap has been patented, so there is a copyright on it. But I think you will find that it's a very user-friendly way of using syringes, and in that way dispensing any liquids in a most accurate way without creating a mess.